Well, we're joined now by Cecile Richards of Planned Parenthood. Thank
Hello.
you. Quite an ovation that you got earlier. It seemed like you got the crowd going. You were the first to mention Todd Akin. So I want to start right there. Todd Akin, how important a moment is that from your perspective in terms of clarifying the choices in this election?
Well, I think everything that's happening here is clarifying the choices that women have in this election. I think Mitt Romney's done that himself. And I think he's taken positions that are so extreme, so out of the mainstream. I think Todd Akin is just one example. But when you have a candidate running for president who said he's going to get rid of Planned Parenthood and overturn Roe versus Wade, it's hard to get much more extreme than that.
Tell us, when you're talking to women voters, though, in some of these focus groups, where they put these issues in terms of their priorities. I mean, we're hearing a lot about the fact that they're just worried right now about putting gas in the car, about getting groceries done. Is this something that is really breaking through with voters in the way that it is in the political arena?
We're finding it absolutely is, and particularly with independent women and women who haven't been able to pay much attention to politics. They know very little about Mitt Romney. They say that. And, you know, the thing I think is important to remember is that the issues of access to health care, affordable health care at Planned Parenthood, that is an economic issue for women. You know, these are, I mean, whether it's getting access to your basic women's health care, getting health insurance coverage for preventive care, these are things, frankly, that Mitt Romney has said he's going to get rid of day one. And those, for women, those are bread and butter pocketbook issues.
Now, you're the first person, though, to really make this connection between the economic and the issue itself. So are you frustrated that Democrats haven't done a better job of this, or that the White House hasn't made that connection as strongly as you would like?
No, I think it's actually, I've heard a lot of people talk about it. I mean, I'm frustrated with people who sort of somehow lump birth control and women's health care as a social issue.
Right.
Well, it's only a social issue if you've never had to get birth control. For women, these are basic issues. And I think that, again, we've seen and seeing in states all across the country, Iowa for one, where when we told women in Des Moines, Iowa, what Mitt Romney was pledging to do about women's health care, they simply won't vote for him.
I just want to ask you, because Ann Romney had that big moment last week. I love women. I love women. What do women hear when they heard that, do you think?
Well, I don't know what they heard, but I think women are going to look beyond the platitudes, you know. So it's not, don't look what I say, look what I do. And I think when you look at Barack Obama's record with women's health care, he's done more to expand women's access to health care than any president, certainly in my lifetime. And it's going to mean a difference for millions of women across America. And I think women are just beginning to focus on this election. I think it's going to be really important.
Are you surprised at how often these issues, whether it's abortion, and of course we've now heard a lot about Todd Akin and his comments, how much they've become part of the debate politically as well as in this hall? I mean, there was a time at which Republicans used some of these issues as a wedge against Democrats, saying this is the way that we can split more conservative Democrats away from their nominee.
Right. No, look at what I've seen. I mean, this convention in particular, watching the crowd last night, watching them tonight, every time anyone talks about women's health care, women's access to health care, the crowd erupts. And I think it's because women really feel like they have been under assault. You know, the record number of bills introduced in Congress and in the state legislatures taking away their basic right to health care. So I actually think this is it's very interesting to see. I think it's a very mainstream issue.